Welcome to Health is Wealth with Dr. Mike. I'm station manager Tina Cortez, and my co-host is Dr. Mike Carrozza. Good morning, Dr. Mike.
Good morning, Tina.
Nice to be back with you.
Well, Tina, I'm not going to lie. We missed you.
Yeah, don't even
Tina,
go
come on.
there.
Tina, we actually missed you. Okay, and Jim did some awesome. He was amazing, and it was a great fill-in.
He's fantastic.
And he was incredible. We had a couple of nice shows.
You guys
amazing.
had a bit of a bromance.
Yeah,
frankly, and I was a little perturbed. I know that you didn't want me to be part of the sports injuries show last week.
That's not true.
I won't take that personally.
No, that's not true. And I actually missed you.
You're funny. Okay, now I'm blushing. Let's move on. Today our topic is one that unfortunately affects almost everyone.
This segment is going to hit home to a lot of our listeners, and I think cancer is a big one.
It sure is.
And although we're not going to focus predominantly on prostate cancer, but we're going to talk a lot about some of the research and some of the latest data to suggest what we can do to prevent this. And of course...
Is it preventable though? Or is it just, the hand that you're dealt, as they say?
Well, I mean, genetics does have somewhat a lot to do with cancer, but predominantly what we're looking at right now, and a lot of the data and a lot of the studies, is lifestyle.
You mentioned genetics. What role do genes play in all this?
So it's a very small role, but obviously the predisposition for certain cancers come with hereditary. So sometimes if a family member's had it, mom or dad, likely that's passed on. But we talk about this a lot. We talk about how we're dealt with a deck of cards, and we can reshuffle this deck. And we always talk about this, Tina, and I love this.
And you talk about this in terms of lifestyle choices, diet choices, right?
This is the key. I mean, look, the data's out there. 30% of all of deaths are related to cancer. It's a big number. We got about 220,000 new cancer diagnoses per year in Canada. I mean, that's huge. And let's talk about how many people die. It's about 83,000. 83,000 people. That's 8 deaths per hour. It's very tragic. And there's things we can do because the research is up.
So shocking.
It is shocking. Every hour that goes by, 8 people are dying. I mean, it's incredible. I mean, it really brings forth, us to, and of course, since the Prostate Health Awareness Month, the Movember, since this big movement, I mean, we've created this awareness. They're catching things early. It's helping. We know that things like dietary interventions can take place, and we can actually prevent this. And some of the data we're going to talk about today is actually going to be very useful for a lot of our listeners.
Are there foods to avoid then?
Absolutely. So, I mean, let's get right into it. So we know that there's lifestyle factors, and the first important food, I believe, to avoid is processed foods. Now, a lot of people say, what is a processed foods?
Right.
So these are our hot dogs. These are our sausages. These are things like cured meats, like luncheon meats, ham, and bacon. Now, let me just put this one step further. So if you consume about 12 hot dogs per month, your likelihood of developing childhood leukemia is like 9 times greater. Like that's a stat that really brings... It's crazy. And then if you even look at it, if you just have, one a week, you're still increasing your risks of things like brain cancer. Mm-hmm. So, I mean, hot dogs. Who doesn't love hot dogs? But I mean, this is a processed food. So we're going to talk about this is that, look, once in a while, you're at a barbecue, but this is something that kids are eating every day. And it's the children that we actually have to protect. And there's a lot of things that we can do. And then we're going to keep going on the list because I think it's important. But, even like burned and overcooked foods, this is the polycyclic aromatic and the hydrocarbons. These are the PAHs. Okay. Now, this is the when you grill your food and that burning process, right. It must taste nice, but it actually is a toxin and it causes cancer. And we know this. There's a link. So, and besides the fact, obviously, we're not going to talk about things like smoking, and because we know that obviously there is correlation. So we're going to just try to talk about maybe some of the hidden things that a lot of people don't know. And for our listeners out there, we know about alcohol consumption, but there's obviously a limit. So maybe, if you're consuming about 3 to 4 drinks per day, that's a problem because you're going to increase things like your causes and risk factors of developing gastric cancer.
What about dairy?
Okay, now dairy is a big one, specifically about prostate. I mean, if you consume 2.5 servings of dairy per day, you're going to increase your risks of prostate cancer. Now, a huge study came out, and this was a 28-year-long study with 21,000 individuals, and this was a physician study. So basically, those who consume 2.5 servings of dairy per day had a higher chance of developing prostate cancer. That's over 28 years and 21,000 people. I mean, it doesn't lie. But a lot of our listeners out there is going to be like, what is 2.5 servings of dairy? That's equivocal to a cup. So a cup of dairy a day for a man is proven to be detrimental in terms of increasing the risk of developing prostate cancer. So, I mean, we have to keep ourselves in check. But there's more. Refined carbohydrates, like obviously sugar, white breads, white rice, sodas, and fruit juices. So obviously this causes high blood glucose in the blood, and this increases things like insulin, which actually then increases things like inflammation. We're going to talk about inflammation and how it's probably one of the hidden causes of this major illness. But the glycemic index measures how fast carbs turn into sugar in the bloodstream. So it's how fast this actually carbohydrate that you're eating, this white refined sugar, can turn in to turn into sugar that will actually give rise to inflammation. Now, the study actually showed that high glycemic foods actually cause an 88% increase of developing prostate cancer. 88%. So we can't just start eating all carbs. And then it goes a little further because we're like, okay, well, what about proteins? And then you have like the study that comes out with red meat.
Okay, so let's hold it right there. Let's take a break. And when we come back, Dr. Mike will take a deep dive into what the studies show. This is Health is Wealth on 105.9 The Region. Stay with us. You're listening to 105.9 The Region, and welcome back to Health is Wealth with Dr. Mike. I'm Tina Cortez, and my co-host is Dr. Mike Carrozza. And continuing now our conversation about cancer. Dr. Mike, where did you want to take it from here?
Well, we always talk on the show about inflammation. We always talk about inflammation is the root cause of a lot of illnesses. And in particular, this particular segment, we're going to direct our attention and our focus to cancer. But inflammation is something that we need to combat if we want to have a fighting chance. And that's the key. Now, we do a lot in terms of discussions on this show about how to be anti-inflammatory. We take our omegas, we eat more anti-inflammatory grass-fed beefs, we buy our organic grass-fed food at Nature's Emporium. We do our best, and that's important, and that causes an anti-inflammatory cycle in our body, but it's not enough. So we need to supplement. And then, so I have some, for example, I have some turmeric shots here from Nature's Emporium. And these are wonderful because it's all organic and it's a cold pressed juice. And you're going to get some really good anti-inflammatory effects by this. But unfortunately, the inflammation in our body, because of the variables and the many different factors that are involved in inflammation, it's so high that we're going to need another answer. We're going to need more support. And so taking this every day is great. It's going to be wonderful, but supplementation is proven to be instrumental. I just want to get back to things like the foods.
Yes.
Okay, so in terms of red meat, which we know that predominantly will predispose us to inflammation, it's interesting how, the recent research comes out as increasing risks of colorectal cancer. And so, how much is too much? Well, if you consume more than 18 ounces of red meat per week, that's too much because that's going to increase now your risk. So what's the answer? What are we going to do? Well, we have to have meatless Mondays, let's say. There must be days in which you can incorporate. A lot of medical doctors, a lot of researchers actually promote this and have meatless days because not only will it help you do something else in the kitchen, but it doesn't mean that you have to have meat in the diet all the time. And so we're not saying just go 100% vegan, stick to plant-based. Obviously, the grass-fed beef is way better. It's more anti-inflammatory, but we want you to limit it. And we talk about this a lot. And then things like salted and cured things like fish and pickled foods will increase things like your gastric cancers by about 50%. And this is big in Asia, and we're seeing this moreover now. And then, on my list is microwave popcorn. It contains the perfluorinated compounds, and this is what causes the, you've seen the resistance
sort
in terms
of goop at the end.
Well, it's more of the paper, and then it prevents things like leakages. So it's an easy fix. I mean, just air popcorn. air popcorn with some olive oil and some cracked pepper or salt, and you're good to go. Have you ever tried that, Tina?
I have not.
You got to just air pop.
I like the old-fashioned oil
What's
pot
better?
on the stove, right?
Oh, you know what? It's better than the microwave stuff, so I'm not going to lie.
Okay.
I mean, and then the last thing that's really, I hold it close because it's hidden. It's the food dyes. Now, this has benzidine in it. So the food dyes, now really, if you think about it, why are people putting food dyes in sports drinks, medicine? Like, it doesn't really add to the nutritional value. It's not delivering the medicine in a fast way. So, like, why is it there? Just to look nice?
It's aesthetics, isn't it?
But it's terrible, and they're actually linked to causing cancer. So when you look for medicines, always look for the medicines that have no dyes. That's important. And then really just stay away from this kind of stuff, because these colored foods just really look nice, but they don't offer any nutritional value.
Okay, after the break, Dr. DeStefano is back by popular demand. This is Health is Wealth on 105.9 The Region. Stay with us. You're listening to 105.9 The Region, and welcome back to Health is Wealth with Dr. Mike. I'm Tina Cortez, and my co-host is Dr. Mike Carrozza.
Tina, I'd like to welcome back, of course, Dr. Fabio DeStefano. The reason why he's here, obviously, is we had a tremendous show at the top of the month. And then because, of course, we're going to be discussing things like cancer and the root cause, which we want to uncover. And we have one of the leaders in terms of turmeric research and inflammation. I mean, this man is a genius, and I'm happy to have him. Welcome, Dr. Fabio DeStefano. I appreciate you coming on the show again. Thank you very much.
Always a pleasure being here, Dr. Mike.
So thank you. So, I mean, our focus today is on cancer. We just talked about, obviously, a few dietary and lifestyle changes that will actually help individuals, prevent, some of this inevitable things that can happen, especially cancer in many forms. And of course, being November and right at the end of the month, prostate awareness is amongst us. And so this is where, there's strong clinical evidence, showing that inflammation is the root of cancer, is one of the root causes of cancer. Correct. And I'd like to bring on your expertise on this, because I know you've actually done a lot of research. I mean, you wrote the book on this, and maybe you can elaborate a little bit for our listeners on this.
So, I'm glad to be talking about this subject in particular because it hits home for me. And as I mentioned on my previous show, I lost my mother to lymphoma about 15 years ago. And it was at that point where her oncologist had told me to focus on this link between inflammation and cancer is becoming more and more apparent. In fact, this goes back to the 1800s. Dr. Rudolf Virchow was a scientist and pathologist who had said that the rise in cancer will be due to the strong link between low-grade persistent inflammation and cancer. We all know that, again, discussing from our previous shows, that inflammation is good when it's under control. Once it surpasses the controlled state, that's when it starts to cause destruction or malformation of healthy or normal cells. At that point, that's when the cancer cascade can start.
And that's when it sort of gets almost like it has that volcano-like effect, where it starts erupting slowly, and then all of a sudden it has this, last sort of result. And unfortunately, there's nothing we can do sometimes.
Exactly, because again, with cancer cells, when you look at the inflammatory cycle, there are chemicals called inflammatory cytokines that, when they are present in high numbers, this is what causes the replication of cancer cells and then the formation of tumors. So anything we can do to stop that cycle, that inflammatory cycle, what we call chronic low-grade persistent inflammation, and that's really a misconception as well, because people are always looking for swelling. It doesn't always equal swelling.
Correct.
So, in my mind, we would, the way I describe it to patients, is a silent killer. And so there's certain markers that we talked about on our previous show that we can look at, to look at your risk factors.
Can you stop the cycle?
You can. And you can slow it down. So as Dr. Mike said it beautifully, that lifestyle plays a big role in this. And in fact, genetics, as he mentioned, plays a very small role. Okay, and that's surprising to most people.
It really is, I think.
Yeah.
And so, let's look at, why turmeric? Why? Let's talk about why turmeric and why this can help. and how this can help.
And that has been the focus of your research primarily.
Correct. I mean, going back, over a decade ago when I started this mission with this looking into the research of inflammation and cancer and all of the chronic diseases. Again, what we found through this the in-depth research and dealing with various researchers across the world, turmeric kept coming up. Why? Because there's over 1,000 studies showing its anti-cancerous properties. And that's why it's important.
Wow, that's a lot of studies.
It is, and we're not embellishing, and because these are actually credible studies,
Double-blinded, placebo-controlled,
double-blind,
legitimate.
Absolutely, and that's why it's important to have a full spectrum turmeric, because curcumin, as we know, has the most medicinal properties, but with a full spectrum, you're consuming curcumin plus over 250 other anti-cancerous properties. And that's why with our ultraviolet turmeric, it's been proven to help not just chronic disease in general, but with cancer and specifically prostate cancer. And I'm glad you brought that up, Dr. Mike, because in studies, they've shown that it can reduce PSA levels by almost 50 to 60%. And PSA is the prostate-specific antigen.
Yeah, we spoke about that on our last show for sure. The PSA is what you measure in males now to measure to see if their prostate is in the clear.
Can anyone take turmeric?
Absolutely. We made it, especially with the ultraviolet turmeric, we made it very safe to consume. There are no additives or adjuncts. So essentially, they've taken the entire root with a triple extraction process, put into a capsule. Patients have to be careful if they're already on blood thinners, because turmeric does have blood thinning properties. So you just want to check with your medical doctor. In the odd time, it may give some indigestion or heartburn. So if you're predisposed to that, then just be careful. Or also make sure you take it after meals and drink lots of water.
So I think the most important thing is, we definitely have the scientific studies that turmeric is there, and then what's really unique about your product, and I know you've mentioned this, is it remains in the bloodstream for a long time. So it's about the bioavailability, and I think that's the difference between the delivery system. I mean, so he has something here that's quite unique. I've seen it in my practice, and I definitely use the product, and it works really well for my patients. And shout out to some of my patients who are using this product and feeling great on it. And it's because I've tried other turmerics before, and this one you need a lot less, and it's it has like a bigger absorption, like a more
highly concentrated. I mean, we're the first ones to educate our patients and the public that you get everything from your food. However, there's a limit. Right. This is why we need supplements like this.
Well, for sure. Absolutely.
And so we really classify this product as a whole food supplement because the liver recognizes it as a natural supplement, and there's no side effects on your organs. Any enzymes stay, pretty neutral levels.
Yeah, and that's a good point because Tina, sometimes if you take turmeric, and there's traditionally turmeric has been combined with things like black pepper, and that would elevate one's liver enzymes. And so it would actually, get some red flags. And so the medical doctor who's doing their annual physical would say, hey, what are you doing here? Are you drinking some excess alcohol, or why are your liver enzymes being elevated? And this doesn't happen with this product, right?
It doesn't, again, because the studies that were done, they measured enzyme levels in the liver specifically and found that there was no change.
Wow.
There's something called glucuronidation, where we break down substances that go through the liver.
So the detoxification pathway.
Exactly. And so you're not really affecting it. There's no negative side effects when it comes to that. And so it gets in a lot more efficiently and faster, 3 times faster absorption and 10 times greater absorption in the bloodstream up to 24 hours. And we all know that for anything to have positive effects, at the optimal effects, it needs to stay in your bloodstream more than 4 to 5 hours, and we're at 24.
Where are cancer rates the lowest? And is there a correlation between the use of turmeric and the rate of cancer?
I'm glad you brought that up because that was my next point. Studies now show that countries that consume high quantities of turmeric have the lowest rates of cancer, such as India. Wow. They, in fact, have 10 times lower rates than North America. But it's important to point that they're consuming turmeric on a daily basis. So when patients say to me, I don't need to take supplements, I eat turmeric. Well, how often do you eat turmeric? Well, 2 or 3 times a week. The absorption rate is very, very low, and it doesn't stay in your bloodstream very long. In countries like India, they're consuming large quantities on a daily basis with foods that assist with absorption. Curcumin, again, it being the main component, main bioactive, is also present in curry as well. So this is what gives it its yellow golden color. So this is years and years of high amounts. You look at things like dementia, as we spoke about and previously, that their rates are 2% in the world. And so this is why, again, going back to the full spectrum, because even what they're consuming is a full spectrum. They're consuming the entire root, and that's what we've done.
And this is the difference. I mean, using a functional food and this kind of nutraceutical, if you will, this is how we call it today. And this functional food, a nutraceutical, when you put it in a capsule, it's really interesting because now you're encompassing the entire root, I guess, right, Dr. D?
Correct.
So like it's the entire root you're utilizing, almost like these shots here that we're dealing with. But you'd have to probably take maybe 100 of these to have that effect, depending on the individual. But you have that bioavailability. You're utilizing the whole entire root, and then things like the research in places like India, because they're actually consuming the whole root. And so I think, just extracting the curcuminoids is not the answer. I mean, I think, the latest research is using the entire root, right?
Well, that's the great thing about all this research is that they've known for years, and in general, there's over 6,000 studies on the medicinal effects of curcumin. So the scientists that I worked with out of India found that, well, let's see what else is in this root. And they discovered that there was over 250 other non-curcuminoids, which were very important or vital to preventing disease or inflammation. Going back to the link between cancer and inflammation, not only does it help with the prevention, it also helps with decreasing the development or metastasis or spreading of cancer cells.
So after a cancer diagnosis?
Absolutely.
And then even like angiogenesis, which is actually stops.
Exactly. Well, that's the whole process.
What is that? Could you explain that?
That's actually, so cancer cells need to replicate, and so they need to live. And so they create angiogenesis, which is the creation of the cell, but then the cell needs a blood supply. And so I believe what the research is, and Dr. D will clarify this, is that it cuts off that blood supply?
Correct. So the tumors, in order to grow, they need new blood vessels. Turmeric has been shown to cut that off.
Wow.
What's really interesting to me, Tina, is the fact that turmeric bioactives, all the ingredients inside that root, know to destroy bad cells and keep your healthy cells intact. That was something very, very interesting to me. Whether it's cancer, whether it's Alzheimer's, any other autoimmune disease, it knows to keep your healthy, normal cells under control.
What do you want to say to a skeptic who says, you know what, come on, if this was the be-all and end-all, if it was the cure-all,
right,
why isn't everybody taking it? Why don't we know so much more about it?
Because it's now coming out. Even though this goes back to thousands of years,
yes,
the Westerners and the scientists are now diving more into it. Stay tuned, because the world will know more about this. And I'm happy to report that this is the first time in my practice, in my clinical experience, that we're now working alongside medical doctors. And they are now prescribing it to their patients, including Mount Sinai, which we're in trials with right now, as well as urologists. Now, going back to, I know we keep going back to prostate. Mm-hmm. Urologists are now calling me and informing me that PSA levels with ultra-bile turmeric are going down between 60 to 70% after 30 to 60 days.
So for men who've had a prostate cancer diagnosis,
right,
if they start on this,
yes,
this will help to keep cancer at bay?
Correct. And slow it down. They've said, cancer specialists have said that prostate cancer is one of the better ones, if you will, because it's slow growing. And turmeric has been shown to prevent the spread of those cancer cells.
And even if you have that BPH, that benign prostatic hyperplasia, which is the precursor, which is not cancer per se, but it's that overgrowth. It's that growth that actually is not really normal, but it's starting to change things. Turmeric is going to help with this, right, Dr. D? It's also going to help with people with BPH. So, we're talking about prostate, we're talking about cancer predominantly, but like the BPH, which will actually could predispose you to having this, you can do some prevention on this end in terms of this anti-inflammatory. So, I mean, I think it's amazing. It's wonderful how bringing a nutraceutical, and Tina, just to make a mention, because you for the skeptics, we have to look in places where we never looked. Scientists, myself, I'm a scientist as well. And so we have to look in places where you just haven't looked before, because we have to just win. We want to win this battle on cancer. We want to win this battle on autoimmune disease. We want to win this battle to get patients well.
Hear,
and to
hear.
get true wellness.
Correct.
We got to look in places where unfortunately we haven't looked a lot.
Not to sound redundant, such as other supplements that everyone has the cure. This is all about prevention. We know that prevention is better than the cure. But because of what I found in my own practice and on a wider scale in the market with consumers, the results are just phenomenal.
Absolutely.
So we need to get this message out.
And you know what? Evidence-based natural medicine is where it's at. It's what's going on right now, and we're helping people. And we hope that our listeners are taking this information and really taking it to the next level. And so this is for all our listeners out there. I wish everybody well, and thank you for listening in. And thank you, Dr. D, for coming on the show.
You're very welcome. And again, my pleasure for being here. And again, thanks for having me on the show.
Where can our listeners contact you, Dr. D, and get a hold of that book?
So the book and the product, Amazon.ca and .com. We're also at your local Rexall. You can visit our website at drd'sturmeric.com. That's drd'sturmeric.com. They can contact me at my clinic at ProMedics Sports Injury Wellness Center in Thornhill, 905-882-7688.
And Dr. Mike, just before we wrap up the show, if our listeners want to connect with you and your team at AppleMed, how can they do that?
So www.applemed.ca. They can reach us at 905-417-4000. AppleMed Clinic is our tag. We're on IGTV. This is AppleMed. And of course, if you need Dr. D's bioturmeric for all our patients out there, of course, you know where to get it because we use it. We use what works in our practice. And so thanks again.
That's our show for this week. If you missed any part of Health is Wealth, go to our website, 1059theregion.com. I'm Tina Cortez. Thanks for listening.